A varicocele is the result of having blood pooling in the veins around the testicles. Normally, the blood will rapidly come in by the artery and be taken away by those veins. In somebody with a varicocele, however, the valves aren't functioning properly, and so they end up having a lot of blood that ends up staying in the testicle, which causes a lot of unwanted side effects. Everybody presents differently, and there can be a variety of things that men will experience. Some will feel a dull, aching pain on the affected side. Some people feel a heaviness or a dragging that they'll describe as having pants that are too tight. They can notice that one testicle may be smaller, and usually it's the testicle on the side that they're having those symptoms from. They may even notice a corded structure that feels like a worm on the side that they're having the pain on, and that's the dilated vein. And in some studies, people can experience low testosterone levels and have systemic signs and symptoms from that alone. In addition, men can go on to experience infertility and can have fertility problems in up to 40% of the time that a varicocele is present. Generally speaking, we find them in young men, and there aren't real strong correlations between any dietary modifications or doing any sorts of activities. They do tend to occur more often on the left side just because of the way the left testicular vein inserts into left renal vein. But why that would happen in one person as opposed to the other is not well understood. If a person is not trying to conceive and they don't want to, and they're not having any other symptoms from their varicocele, then they can be safely left alone. But the longer that it's left untreated for can cause further infertility issues down the line. And so if someone thinks that later on they may be wanting to have children, then it's something that should be looked into. In interventional radiology, we use tiny catheters and enter in the venous system, either in the neck or in the groin. The body is a big highway. We just have to get onto the entrance ramp. And once we travel through those veins, we're able to embolize or stop blood flow to certain areas of the body. In this case, we would travel using ultrasound and fluoroscopy, which are dynamic X-rays, into the damaged veins. And then we would stop the flow within those veins so that the testicle will make use of other venous pathways to be able to return the blood in a more efficient pathway. It's an outpatient procedure, lasts about 60 to 90 minutes, and the person goes home same day with just a Band-Aid on their neck or groin, depending on where we access. During the procedure, it's actually surprisingly not painful. The veins don't have pain receptors like that. And during the procedure, just in case, we have extra medications we provide in case the person is uncomfortable. After the procedure, some people may experience minor aches that are very normal post-procedure, easily taken care of with something like Tylenol or Motrin, and we're able to manage it on an outpatient basis. So we're highly successful at treating these. We have a very high technical success rate, above 90% in terms of treating these conditions. And patients who have pain, up to 80% of them will have complete resolution of those sensations. If someone is thinking or was told actually that they have a varicocele, they should feel free to contact Columbia Radiology and schedule a consult appointment to help get evaluated for it.